Dizziness is a very common problem seen by any neurologist. It's a very complex topic. There are many different reasons. I'll try to make it very, very simple. It may be too simple. We'll focus on three main causes of dizziness. First cause is vertigo or a spinning sensation. And other cause patients may report is postural lightheadedness. And the third one could be unsteady feeling on feet. The first cause, or vertigo, is usually a spinning sensation. Patients report that they have sudden onset of spinning sensation. They feel that whole room is spinning, or their head is spinning, or their body is spinning. This type of spinning, when it starts acutely. It is episodic. It comes and goes. Although in between episodes, patients still may feel unwell. Each episode is brief, and as time goes by, it may become less and less intense. This type of dizziness, vertigo, or spinning sensation is triggered by head movement or sudden change in position of body. When patients are lying down and they roll over in bed, the dizziness may be triggered, or if patients bow down or do any sort of quick movement, the vertigo or spinning sensation becomes much more intense. There are certain maneuvers which can be used to diagnose these cases, such as Dix-Hallpike testing, in which patient with a certain position of head and neck is made to lie down quickly, and the neurologist notices certain things to diagnose whether this is due to a problem related to brain or to other causes. The most common cause of this kind of problem is benign paroxysmal positional vertigo, and in some cases acute labyrinthitis. This is a treatable condition, and it does improve with time, although it may take several weeks. The second cause of dizziness, the postural lightheadedness, it usually happens due to drop in blood pressure when a patient from a lying down position or a sitting position, they stand up. Their blood pressure drops. Most of these patients are elderly. They could have other conditions such as Parkinson disease or diabetes. They may be on blood pressure lowering medication, which were started at some time, and they were never visited again whether the same dose is needed. So in certain conditions, the blood pressure may drop slowly, and the blood pressure medications need to be adjusted. Patients can manage this with adequate drinking of fluids, gradual rising, using compression stocking, etc. And they can speak to their family physician, who can monitor their blood pressure, and adjusting or lowering the dose of blood pressure medications may help to resolve this postural dizziness or postural lightheadedness. These patients sometimes feel a sudden feeling of passing out. When they stand up, they feel that they are weak all over, their vision may become grayish, and they may have a sense of passing out. The third cause, the unsteady feeling on their feet, is due to many different causes. One of the most common cause could be a nerve damage or neuropathy, which is seen in patients who have diabetes or other metabolic conditions. Other conditions such as osteoarthritis, trouble with vision, anxiety, or focal weakness, and other neurological conditions may create a feeling of unsteadiness on feet. Patients should try to describe their symptoms exactly the way they feel, so that the physician or a neurologist can focus on the targeted cause of the dizziness.